Alrighty. Hello, everyone. Thank you so much for joining us. As people continue to log in, feel free to introduce yourself in the chat. Let us know where you're joining us from, what organization you're with, whether you're a CFP volunteer, a nonprofit professional, let us know. But as you introduce yourself, I want to say welcome. My name is Jordan Tobias, and I am the manager of grants and programs here at the Foundation for Financial Planning. We're also joined by Rachel Roth, who's our Senior Director of Grants and Programs, who will speak towards the end of today's webinar. We're so glad to have you with us for today's presentation on expanding financial opportunities for people with disabilities with Elizabeth Yoder, who is a CFP and CFP Board Ambassador. And before we dive into today's presentation, I will like to take a few moments to talk about FFP and the work that we do. It looks like I need to share my screen. Rachel, do you see my screen?
No.
Okay. Just give me a minute, everyone. All righty. So again, like to take a minute to talk about FFP and the work we do to expand access to pro bono financial planning to those who need it most. And people ask all the time, why pro bono financial planning? And the answer is very simple. Millions of Americans need financial guidance, especially right now, but they lack access to quality and ethical advice. So for over 30 years, this year marks 30 years, FFP has been dedicated to bridging this gap, ensuring that underserved communities have the support and resources they need to achieve financial stability. And we do this in three major ways. So first, we develop and support pro bono financial planning programs in partnership with nonprofits across the country, providing grant funding, technical assistance, CFP professional volunteers, and other resources to ensure that these programs thrive. We also recruit and train financial advisors to do pro bono service, and we connect them directly to nonprofits through our website called probonoplannermatch.org. And third, we lead the movement to foster pro bono service within the profession via our original research, industry partnerships, and public awareness activities. And so we also offer a number of resources to support CFP volunteers who are providing this pro bono volunteer service. So first, we have the Pro Bono Financial Planning Volunteer Training, which is a free 1-hour module that helps advisors understand the basics of how to provide pro bono service to underserved communities. And the training is approved for 1 hour of CE credit by the CFP Board. We also offer workshops, webinars like this one, user-friendly disclosure forms for your pro bono engagements, and more. And then again, we also have Pro Bono Planner Match, with CFPs can connect with volunteer opportunities at nonprofits nationwide. Nonprofits, they go on, they register, post a volunteer opportunity for CFP professionals only, and those CFPs are able to browse each opportunity and sign up for them. And then lastly, we offer E&O liability insurance to advisors who connect with our pro bono opportunities through Pro Bono Planner Match, or if they volunteer with our FFP grantees. And then so I encourage every CFP here today to join the pro bono movement in whatever way you can. Whether that's registering on probonoplannermatch.org, signing up to receive our latest news so you can stay up to date on all of our offerings, or support our mission with a gift. Your work and support have a meaningful impact on millions of individuals and family in need, and we just would not be able to do this without you. So if you have any questions or would like to discuss joining and advancing the pro bono movement, please feel free to contact my colleagues listed on the screen here at any time. But today we are thrilled to discuss how to expand financial opportunities for people with disabilities through the power of the ABLE account with CFP Board Ambassador Elizabeth Yoder. A little bit about Elizabeth. So her journey into financial planning is deeply rooted in advocacy and service. After earning her degree in speech language pathology, she became a live-in caregiver for adults with intellectual and developmental disabilities, IDD for short. Through this experience, she connected with the IDD advocacy community and saw firsthand the financial challenges families face, especially the fear of like saving and earning too much and possibly losing those essential government benefits. So Elizabeth, she was determined to make a difference. She became a CFP professional to help families navigate these complexities and secure their financial future. In 2023, she founded Dependent Financial Planning, where she serves clients across the country, offering tailored advice to their unique disability needs. And Liz knows firsthand that these families are often told what they can't do, and her mission is to show them what they can do. So please join me in welcoming Elizabeth Yoder. And I'm going to stop sharing. Okay, Elizabeth.
Hi, everyone. Thank you for joining us today. I'm really happy to be sharing with your community today to provide this information, especially to the folks who are doing the pro bono work and may see a disability from the standpoint of people just applying for services and being all shook up about what they're supposed to be doing. So hopefully some of the information that I share today will be helpful from that point of view and to give you more personal authority to give the advice that they may need in that current situation that they're in. I'm going to start sharing, of course, and here we go. See, this one's probably the best. All right. So the power of ABLE accounts is something that I talk about regularly. A passion of mine is making sure that folks know about the accounts and how they interact with all the government benefits that are out there. I am not an attorney, and this is not an investment advice. This is understanding different tools and systems within our current federal government and state governments that apply to folks with disability. And for more specific advice, just talking with a specialist might be necessary to make sure that you're following through in the path that is best for that client in front of you. Also, if there is legal need to talk about either special needs trust or any other kind of legal planning, certainly consulting an attorney for that as well is important. I am based out of Edgewater, Maryland. I am a fully remote practice, except when I rent out space to meet with people who would like to meet me in person. And I practice in, I'm registered through Dependent Financial Planning in the states of Maryland and Connecticut, working on Pennsylvania, and I have my notice filing in Texas. So there is a picture of me when I was slightly younger, working within a community that was a multi-generational community surrounding 8 really individuals with disabilities in one neighborhood. I lived in as a caregiver for 3 years, and this was the community that came to support these folks who had dependent care needs. And I loved it, and I became an advocate through my relationships with these folks and needed to know more about how to support them in the future and their families of people like them, trying to figure out the pathway forward when dependent care would be needed for the rest of a young adult's life.
There are a few learning objectives that I wanted to address today. We want to be able to define the difference between SSI and SSDI. This is one of the most important and most confusing aspects of disability services and how they are related to Medicare and Medicaid. This is the foundation of working with people with disabilities, is understanding what benefits they're on and how they interplay with each other. Second, we want to outline how an ABLE account and special needs trust protect assets for an individual with a disability. And third, we want to be able to determine priorities of the utilization of the ABLE accounts and or a special needs trust. So we'll go through a quick review of disability benefits. We'll go through the rules and history surrounding ABLE accounts and opportunities and reasons to open one, and case studies of various different strategies. So first up is the all-important Social Security system. Right now, as many of you know, many rules in the country are being reviewed and edited. I don't expect that the main overarching system of Social Security will be changing. However, what will be changing is the processing times for folks who are applying for Social Security supports. I am still seeing people receiving benefits, receiving back pay, and so things aren't changing yet as far as applications that have gone through already. It's just what each system will look like, what each state services will look like is going to be based on those local resources. So supplemental security income is the standard income available to people with low income and low assets. It's that financial and asset, that income and asset means tested benefit program to provide some support to enable people to not be in abject poverty. It is intended to be utilized for housing and food, and the base needs of a person. It's not meant to be used on its own. There are other supports like food stamps and housing vouchers that should be used in conjunction with SSI when someone has low assets and low income. The asset limit is $2,000 for SSI federally, and the income limit we'll touch on later is based on a substantial gainful activity amount, which is defined as the amount of money that someone can earn to have competitive employment. We'll get to that in a little bit later. The monthly benefit for SSI for this calendar year is up to $967 a month. That can be reduced when someone's earnings are above what is waived, what is not countable by Social Security. $20 is automatically waived from anyone earning money. And so this might be news to some people. You can earn money while receiving the base levels of support from the federal government. Having a disability does not require you not to work or earn. It requires your ability to work competitively. Again, that's a specific financial definition within the IRS code. Countable earnings beyond that $20 that's reduced in a whole fund calculation done by the Social Security Administration will be reduced $1. The benefit of SSI will be reduced $1 for every $2 earned. So you basically get to keep half of your Social Security when earning up to that substantial gainful activity amount, and that it'll be whittled away slowly when people are earning more money. On the flip side, SSDI is a program of social insurance. SSI is as well, but we never paid for it. It's not required for us to have worked or paid into this system. It's a protection program of poverty prevention and support. SSDI, the Social Security Disability Insurance, is something that we pay into through our work history. Whether we pay individually as workers for our own benefit, and adults with children pay for their children's disability benefit. We'll touch a bit more on that going forward, but this is a benefit that is paid for and earned, and when someone has worked long enough, and it is directly related. The benefit is directly related to what the individual has paid into the system. So it's contingent on that earnings history. It is only limited by the people need to keep in mind the substantial gainful activity amount when they're trying to receive SSDI. However, if they're just on Social Security and not other federal programs, they don't have to worry about an asset limit. They can still have all of their savings accounts through their work history and still be eligible for that SSDI income payment. It does not have an asset-based test, just an income-based test. The disabled adult child benefit is something slightly different, but it is part of the SSDI program. So someone paid into Social Security for a adult who had a disability classified through a childhood disability. And the disabled adult child benefit, or the childhood benefit with disabilities, CBD, I get them mixed up sometimes. They go by different names. Starts when an eligible parent files for their own Social Security. That could be through retirement benefits. It could be through their own disability, or it could be through death. The benefits will replace the SSI portion of the younger person's benefit, dollar for dollar, with no reduction for earnings up to the substantial gainful activity limit, which for this calendar year is $16.20 a month. The benefit that is received by the younger person when the parent files for Social Security is 50% of the parent's full retirement benefit while the parent is still living, regardless of when the parent files for Social Security. So CFPs who are out there and other people who are aware of the Social Security planning strategies that we already put in place for our families, we're not usually guaranteeing the recommendation to wait for as long as possible for a parent to file for their own Social Security benefit. Sometimes it does make sense to file earlier than full retirement age benefit if it lifts the whole family up from where they currently are, and will expect to benefit that family and that young person and that family from adding to the budget of the young person. That there's no benefit reduction for the young person if the parent files prior to FRA, but there would still be that early filing reduction for the retiring person. So that's always a family discussion of what benefits are important for that time period. The benefit, the child or the adult child's benefit increases once a parent has passed away to 75% of the parent's full retirement age benefit. All right. SSI and Medicaid are interwoven in a lot of people's minds because many states will apply the young person for disability Medicaid at the time of the SSI application or the acceptance of disability benefits. SSI is the gateway to Medicaid in all states, regardless of whether the state applies you for that benefit or not. And it is also financially means tested. States will have a different they'll have different numbers for whether how much of the assets are restricted and how much the income is restricted based on their state program and based on any other program that a disabled person would be considering. Most of the time, the Medicaid asset limit is limited to $2,000 like SSI is, and it would it's lower in the state of Connecticut. I don't know if there are other states. The Medicaid asset limit for Connecticut for disability Medicaid, our Husky C, is $1,600 a month, $1,600 any given month. And the asset limit for California is nothing. There's no asset limit in California. They still have an income limit though. So we have to be aware of the income that that individual is receiving through benefits and through other employment as well, to make sure that we're not excluding that person from receiving those Medicaid benefits. Just to be aware, when many times a family coming to us for advice has been told in the past that they weren't eligible to apply for SSI or eligible to apply for Medicaid at a different point in their life. That may just be the age of the child when they applied. It may be other factors. It may be not having a specific diagnosis. It may be something else. So we have to be clear with our families of what exactly is going on in their life that that would require benefits, and if there have been changes and if they have had clarity in the past, and also just what stage of life they're in. A parent's income is often the reason why people are denied for childhood benefits. And so when a disabled person turns 18, the parent's income no longer applies to that benefit calculation. And they are completely eligible as a single person household for benefits, regardless of their tax status. So we have to be aware that we are applying a lot of times at 18 or slightly after for that adult to have their own personal benefits through SSI and through Medicaid. In-kind support and maintenance may reduce the SSI benefit, which is when a family who's living with their adult child doesn't ask for rent or anything for them to live in their house and receive support. The Social Security has the ability to reduce the benefit by up to a third, and we'll do that automatically unless told otherwise that that young person is intending to use their SSI benefit to pay a portion of what they're expected to for home maintenance. In the end of last year, that changed of what number we're telling people to set up an agreement with their children to receive that full disability benefit, that full SSI benefit, and that is $334 a month to receive the full income benefit of SSI. This is a lot, so I apologize for going through this so quickly. especially folks who haven't reviewed these concepts in the past, but I want to make sure that we get to as much as we can. SSDI and Medicare are intertwined as well. So when someone receives SSDI for 24 months, they are able to enroll in Medicare. This is one of the most important things for families to think about, is the health insurance part of where things are coming from. So if someone is not really caring about the income side of things, they're like, okay, we have assets, maybe not in the pro bono space, but in the general financial planning space, they have assets they can keep supporting their young child. They're not worried about enrollment in Social Security, but it's the health insurance piece that either the person's going to be aging out of work, employer sponsored health insurance. They don't have a disability policy where they can continue that health insurance. The young person can enroll in Medicare as long as there's a work history of receiving those SSDI payments, either through their own work history or through their parents, through the disabled adult child benefit. And Medicare doesn't go away. It's also free for the first 8.5 years of that young person's use of Medicare. And at that point in time, they'll review what the income is of that person to see what the appropriate payment for Medicare would be at that time. It may still be very low or nothing if there's no income to speak of other than Social Security. It may be highly reduced through subsidies. And the laws change, so it's always good to review. What is an ABLE account? So we went through the big systems, the Medicare, Medicaid, Social Security. An ABLE account is one of the tools that we use for families that was set up in 2014 to enable people who have diagnosed disabilities to set up a savings account through a state savings program. It is an investable savings account, and the acronym of ABLE is Achieving a Better Life Experience. It is a tax advantage. So in many states, if you open a ABLE account within your state's program, there might be a state tax deduction on the contribution of the asset in the cash into the account. And the growth within the account, whether it's through standard good old interest payments on cash or whether it's actually invested in a growth model, that payment, that growth is tax-free with it on withdrawal when used for a qualified disability expense. We'll get to that in just a second. So who's eligible for an ABLE? Currently, the law states that a person who had a diagnosed disability that occurred prior to the age of 26 is eligible to open and use an ABLE account. Next year, the law is changing, and the age of onset of the disability would have to be prior to the age of 46. So that opens up a good chunk of people who weren't previously eligible to use an ABLE account to start thinking about that as a tool for them. These are people who are denied disability as a child or denied disability as a acquired injury or as someone who have had a late onset, a degenerative illness or disease that's lifelong, that those people will now have an opportunity to use the ABLE account as that Roth-like investment account. And the ABLE account protects any assets from being a countable resource for SSI and Medicaid purposes. And if someone is receiving SSI and SSDI and are within those age ranges, it automatically makes them eligible without really needing to contribute very much eligibility paperwork to the ABLE account itself. Some states will require additional kind of medical records, letters from doctors stating that the disability exists. But again, if that has already gone through SSI, it's already gone through the disability determination through the Social Security Administration, that paperwork may not be required. Accounts can be established by the beneficiary themselves, that person with a disability themselves, a parent, a legal guardian, and an agent under a durable power of attorney. And what we understand is it's in that order. So if the individual themselves can open the account on their own, do that. If the parent wants to support the young person who may need support but is financially independent, or not financially independent, but is aware of decision making, and make sure that that young person is as involved in opening the account themselves, the parent can open it for them. But anytime that we can give the authority back to the younger person, we want to be making sure that we're doing that. An ABLE account, again, contributions are tax deferred. Now that's here nor there if you're contributing to a state other than your own state, or a state that doesn't have state taxes, or a state that doesn't have a state tax deduction. There's not really, it's just you're making your contribution. If used for a qualified expense that taxes it grows tax-free. There are, if a non-qualified disability expense is pulled out, then there's that growth is subject to income taxation and a 10% withdrawal penalty. There's a unique rule with SSI in that if someone's receiving SSI payments, the account cannot grow beyond $100,000. That is specific to SSI and not to Medicaid. And the trick to avoiding that happening is to use the account. The account is meant to be used. Advantages of using the ABLE, it protects SSI, SNAP, and Medicaid. Again, some of these programs have asset limits that are as low as $1,600 in Connecticut. Most state SSI and Medicaid programs will have that $2,000 asset. And you just want to make sure that you're aware of all of the benefits the person you're speaking with is on or hopes to be on, to be aware of that lowest common denominator, that that benefit that they're hoping to receive the most from. We want to make sure that that asset is protected. And so anything in the ABLE account is excluded from that countable number. A qualified disability expense is included in the federal legislation as education, housing, transportation, employment, training, legal fees, financial fees, medical expenses, assisted technology, personal support devices. Most programs will have a liberal definition saying it is meant for building a better life experience. And so as long as it's a expense for the beneficiary themselves and not the beneficiary gifting a car or a gazebo to a church or something else to just move assets into somebody else's name, it should be an expense that's approved through the ABLE account rules. ABLEs are under IRS jurisdiction. I don't know of any person who has had an IRS review of their ABLE account use, but we just, every family is going to be cautious because they don't want to get in trouble. They don't trust the programs will last the way they expect them to all the time. So the best practice is saying, is it for the beneficiary solely? And is it allowing them to live the life that they would not otherwise live if they only had $2,000 rolling in their bank account? There are ABLE contribution limits, which make planning slightly more fun. you can contribute, any account can receive up to $19,000 a year. It's designed as a 529 plan, like college savings plans, but it has a annual contribution limit for the account itself. And there's only one account. There's not multiple, like you can have grandma have an account for Charlie, you can have grandpa have an account for Charlie, and you can have mom an account for Charlie. This is Charlie's account, and there's only one. And so grandma can contribute, and grandpa can contribute, and mom can contribute total up to $19,000 for the standard contribution for the calendar year. It is tied to the annual gift exclusion amount, and then that changes every year. There's also, if the beneficiary is working and don't have the access to a retirement plan, they can also contribute up to $15,060 in 2025 for their able to work contribution. So if you think about the able to work contribution is like a catch up. That's kind of how we think about it. There are all these rules and laws that are tied into other things that 15,060 is the federal poverty level number from last year. And every year we look back to last year to see what this year's able to work contribution limit is. So in truth, it is a catch up. So you can add both of those numbers together to get the full contribution amount limit for 2025. Choosing the right able, the things that we want to consider are state tax deductibility and Medicaid payback provision language. So the federal law states that the state should take back the asset that is remaining at the death of the beneficiary once that and the account is used to pay back Medicaid that was used during the beneficiary's lifetime. There are a lot of people who don't like this provision, and there are a lot of states that are saying that have legislated the opportunity to not have that payback occur. However, they also have in their law that says, unless otherwise required by the federal government, we're not seeing entirely how this plays out in real life yet. The able accounts are just too new for us to really experience what this actually looks like when a state has a law that is in conflict with the federal law. But I'm sure we'll see this play out in a couple of years. Usually if there's that Medicaid payback provision waiver, then we prefer to use that state that individual's living in, even if we're not sure if that occurs. The ABLE account is still just a savings account. It's not intended to be an asset growth account unless there's specific objectives that the beneficiary wants to have control and management of. So it shouldn't prevent someone from using the account, that Medicaid payback provision. But you want to look at the ability to utilize the account from the perspective of the client, whether it's logistically easy or challenging. It's certainly, we don't want to make our clients' lives more difficult if they're having trouble accessing their account. We also want to look at the fees associated with investment selection. Most accounts are set up like a retirement plan where you can choose a mutual fund allocation to build the asset of the account, but most of them are more built already than having more choice. It allows for people to just make a quick gut decision on how much of my account do I want invested in equity versus non-equity investments or cash. So it tends to be kind of a risk tolerance asset check. There are the flexibility of self-directed investments at Fidelity, which is run through New Hampshire. And there's also the ability to use an advisor through Able America, which is a capital group organization. And LPL also has established the ability to set up an Able account through them. So all of these to say there's many different ways to look at it. I'm usually looking at these first two, state tax deductibility and Medicaid payback provision. There's more resources at the Able National Resource Center.org will give you you can search for your state or the state your client is living in and to see what their state has to offer. And when it's not clear on whether their state is better than others, if there's no state tax deductibility and there's no language saying that Medicaid might not get that money back, then usually using the Ohio plan is the most logistically easy account to set up and to use. That's my grand recommendation, to use the Ohio program. And I'm not an Ohio resident, so congrats, Ohio. The Able account is not an investment, not an estate planning tool. I want to repeat that. It's not an estate planning tool because of the asset, the contribution limits. You are only allowed to put $19,000 in the account. So for those who are working with clients who maybe have limited assets and income, but have family who do not, and who might inherit, we want to make sure that the appropriate estate plan is also in place. The Able account is an investable savings account. Attorneys are listed on both the Special Needs Alliance and the Academy of Special Needs Planners. These folks have spent a good membership fee to say that they are specialized planners in this space who can put together an appropriate estate plan for the inheritance of assets. So these are two good places to look when you have the need of a special needs trust. First party trusts are typically needed either when an individual has assets prior to becoming disabled, has assets granted to them through a legal battle and a settlement, or when an estate plan fails, when families don't put in the right documentation. A third party special needs trust, just to keep these definitions in place here, are trusts that are funded with a property or financials of someone other than the special needs beneficiary. So think this is the inheritance. This is the parents' estate planning. No payback provision is required. So this is one of the primary places where we can have a flow of assets go to the beneficiary and then on to other family members, to other children, to grandchildren, to nieces and nephews. And this is really the true estate planning tool. The self-settled special needs trust is one that, again, is that person's own money. It's their own savings through work. It's their own settlement, or it's money that is unfortunately directly given to them when they are on benefits that needs to be protected. And that's the first party special needs trust. There is a payback provision to the state with the assets that are remaining at the end of a person's life, or at the sale of an asset that's not protected specifically within the time frame or the trust itself. We want to make sure that properties are certainly named within special needs trust prior to when they are sold, to make sure that they have the ability to be reinvested into the individual's plan to the extent that they possibly can. Okay. Take a deep breath. And I'm going to start going through a couple of real world scenarios to kind of think about the tool of an ABLE account in special needs trusts and how it can be used for different types of people. And I'm going to just pause real quick and glance at some of the comments in the chat just so that, okay. I am going to define significant disabilities. So there's a couple ways to define significant disabilities. ADHD can be a significant disability if it impacts someone's ability to work. There are cases of ADHD where it is significant. This is a narrative that needs to be created for Social Security as to why their ADHD is different than someone like me who doesn't have diagnosed ADHD, but has a lot of the signs of ADHD, who could shield their ADHD from their coworkers by having medication and crashing at home or having a party at home, depending on the type of ADHD. So yes, it disabilities that function as that impact someone's ability to participate in standardized work, employment, and engagement in society, that's a disability. If it is managed, it may not qualify as a disability for the purposes of Social Security. There's a list of disabilities that are automatically given. It's called compassionate allowance for disability benefit. There are many things like genetic disorders that would be considered compassionate allowance. But a lot of people just live in that gray area of like, I can't manage, I have an intellectual disability, but do I have enough so that I can't work competitively? Well, then we have to look at like, what are the supports that are needed for someone to work independently or to work with support? And then how is that defined within Social Security standards? So the narrative is going to be more important to detailing the supports required than the disability diagnosis itself for most people. Let's see. The ABLE account is a asset of the student. If they are applying for student aid, it is the student's account. So we want to see standardized 529 plans for people who are planning to use to go to college. I'm going to keep going with these real world securities because some scenarios, because some of these may come up. Case one, low income, low asset individuals. So for you pro bono folks, you may or may not see someone who's been on disability all their life. This is a 50-year-old woman with an intellectual disability. She and her family have been some kind of public assistance for most of her life. She grew up in a large family, and her father worked in the railroads and has railroad retirement benefits as opposed to Social Security. But we're saying Social Security here. 30% of her Social Security benefit goes to help her group home that she participates in Medicaid funding and housing subsidies. So that's most of her expenses, but then she has 60% of her income to use elsewhere. When she is able to use an ABLE account, she can now plan more carefully how her money gets spent. It also now allows her to use a saver's credit on her federal taxes. She does have income. She works in a workshop and gets paid not that much, but the fact that she doesn't have a retirement account at work, she can anything that she saves through the ABLE account will be enabling her to apply for that saver's credit on her tax return and get more back theoretically, depending on anything else that's going on for her. One of the pushbacks that she or her community may say is that, okay, but the fees for investing in the cash within the ABLE account can be just as much or more than hiring an advisor, which I've seen before. Some ABLE accounts will penalize you for having more of the investment in cash because they want you to invest. Now, the statement that I go to here is the fees that are paid allow her more flexibility in what she's actually spending and when she's spending it. So she can save for a photography class that she has at a local community college, that she wouldn't have that rolling asset otherwise. She has, it may be a couple $100 that she just wouldn't have in her account. She can go into her community and have coffee with friends more often. If she has savings in her ABLE account, she can save up for a visit to an old assistant's wedding out of state and make sure that a caregiver can come support her. If she's saving little by little into an ABLE account and not having it sit in her account, her checking account, those fees are allowing her that flexibility. Okay, a young person learning their limits. A young person has graduated high school and college with an extra year and tutoring support. So this is kind of thinking about your question about ADHD. I see a lot of folks who have ADHD and autism put together, and they don't necessarily have an intellectual disability, but they have these developmental things going on with them that might make it difficult for them to pay attention in class, to do their work independently, and to write without support. They've never learned about their state's programs because they assumed they would find work like all their peers without autism and ADHD diagnoses. They can only really tolerate 10 to 20 work hours a week because otherwise they get emotionally burnt out. They have saved money in a checking account and are supported well by their family. An aside, okay, so this is a fun one, and one of the reasons why I like saying I'm an advocate first and I'm a planner next. This is just a review on state minimum wage law. It greatly matters when it comes to Social Security's substantial gainful activity. So 20 hours a week in California at $16 an hour is $13.86 a month. So the maximum hours, these were last year's numbers. I want to clarify. The maximum amount of hours last year that someone in California could work while receiving Social Security's income is 22 hours. At DC, the minimum wage was 17.5, requiring someone to limit their work hours to 20 hours a week. Maryland, Massachusetts, and New York, 23 hours. The federal minimum wage in 2024 was $199,000 a month. And that's 35 hours. So someone could almost work full time. Some places that would be considered full time and still receive disability benefits because that's considered under substantial gainful activity. So, and then this is, I wanted to clarify, this is 35 hours is $10.99. So substantial activity doesn't actually hit until someone has worked over 9 hours a day at minimum wage. So if you're in a minimum wage state and have a disability, you could receive disability benefits and work full-time or two part-time jobs beyond full-time before beyond 40 hours a week. If this young person who is limited to 10 to 20 hours a week is living in a state that their income doesn't reach beyond substantial gainful activity, they can apply for an ABLE account and put their savings into an ABLE account. They can invest the account for long term while their parents continue to support their daily needs above what their benefits would enable them to receive. And the parents can theoretically get a state tax deduction for the gifts into the state's ABLE account. One of the common pushbacks for this strategy is that the account can only grow to 100,000 for benefits to continue. And their response to that is, if the individual is only receiving SSI, if they go on to receive SSDI because they're working, young people can become eligible for SSDI within 3 years of working, or when their parents file for Social Security, that rule no longer applies. So, and we can spend that asset limit down. We can buy a computer, we can take a local community college course. I want to stop here and go back to your questions because I know we only have 5 more minutes. And let's see what we've got here. And well, you know what? I'll put up my my contact information as a slide while we're going through some questions.
Yeah, while Liz is putting up the questions, just a quick housekeeping. So if you're a CFP professional, FFP will submit your CE credit to the CFP board. If you're an AFC, you will submit your continuing education credit to AFCPE using the code FFP16, and we'll put that in that chat, but that's if you're an AFC, you submit it to AFCPE yourself. If you're a CFP, we will submit your CE credit for you to CFP board. Just wanted to make sure that's clear, and we'll take a few questions.
All right. So I'm not able to pull them up at the moment.
Yeah, so I can go through some of them. So
yeah.
Let's see. If someone has an ABLE, are they eligible for the retirement savings credit? And then
It's not in a retirement account, so they are eligible for the savers credit because the law has allowed contributing to an ABLE to go towards that credit. So yes, the savers credit, but it's not a retirement account.
And are ABLE accounts only available for people on SSI or SSDI?
No, you don't have to have ever applied for those things. As long as you can determine that you have an eligible disability, you can submit that paperwork to the state's program and they would approve it. People don't always apply for SSI and SSDI if they're working or if they have problems with being on government systems, such as Social Security, then they may not have ever received that benefit or care to, but they can still be approved to use an ABLE.
Does aging out of foster care qualify for ABLE account, or only if there's a disability?
Just a disability. If there's a disability and aging out of foster, certainly, but no, the ABLE account is a disability specific program.
Is an ABLE account opened and funded by a parent or grandparent still subject to being a countable asset when it exceeds 100,000?
The account itself is restricted from growing beyond 100,000. It doesn't matter who contributed the amount.
Okay. If the beneficiary passes away, how is an ABLE account inherited?
So there are states that will receive a beneficiary designation, and oftentimes some will say that it's able to be given to another eligible beneficiary through another ABLE, basically. That's state dependent. Some will have non-disabled
beneficiaries, but then it would be distributed as if it was a non-qualified distribution. So there would be a retained amount within the account that could go back to the state if there's anything beyond, or if the state was reclaiming anything, and then it would go on to that second beneficiary. The planning tool is to try, when someone is aging, is to try to spend down the account as much as possible and to use it up, because it's the person's money and we want to make sure that they use it.
Got it. And we're out of time, so we'll do one more question. There's a lot of questions regarding ABLE eligibility. With the change to age 46, would this include people older than that who were diagnosed after age 26?
Yes.
But before age, okay.
Yeah. So this is opening the door for people who got denied many years and told they weren't eligible. So it's going to be a lot of re-education of people who thought they weren't eligible, because they weren't. And now they are.
Wonderful.
Yeah.
Thank you so much for being here today. You really helped us understand this very complex and detailed topic. You know, there's a lot of questions and interest, and we really appreciate you being here. And just a reminder for AFCs, it's FFP. So Frank, Patricia, 16. So thank you so much, Liz. We really appreciate you being here today.
I wish I could be here longer because there's so much to go over, but thank you. I really appreciate sharing this with all of you because it comes up a lot in the pro bono space. And I just want you to feel more empowered to make choices and to advise your clients in ways that will have immediate impact on their lives to move forward with whatever they're going through. Thank you.
Wonderful. Thank you again.